My name's Helen Bevan, and I've worked in the NHS for 25 years as a change agent. So what I do is I support and facilitate large-scale change efforts in the NHS. And I try to help to introduce experience and evidence and innovative ways of doing things so that our change processes can be better and faster and more sustainable. So I actually worked in the NHS when I was a student because my mum was a cleaner in the NHS, a domestic assistant for 27 years. So, I always kind of loved the NHS, and it was always a big part in our household. And I learned a lot from my mum, because she had fantastic values, and she used to clean the flats of trainee doctors and medical students, and she used to look after them and care and do their sewing and bring their washing home. So I don't know, it kind of rubbed off really. So I always wanted to work in the NHS. And I joined the NHS when I was 31 on a scheme for people who were leaders in other sectors. So I worked in local government and I worked in training and development. I was really happy to join the NHS. So, lots of people have influenced my career, and I think, one of the most important things to do, and particularly in the early stages of a career, is to find a line manager, a boss who gets you. So I'm a very kind of creative, innovative person, and I'm constantly asking questions and rocking the boat. And lots of managers don't like people like that. But actually, if you get the right kind of boss, you can fly and you can really make, lots of great things happen. So, the people that have really influenced me are some of the really great bosses that I had when I was younger, people that took a risk on me and pushed me to do things and believed in me. And then, because I'm a change agent, a change activist, I get to link up with other people all over the world that lead change. So lots of them influence me, but probably the people that have influenced me the most are the amazing people that I get to work with doing change. And so some of the work I'm doing at the moment, for instance, is around people with learning disabilities and psychotropic drugs, because basically what we keep doing as an NHS system is giving people with learning disabilities drugs to kind of keep them quiet, when most of the people with learning disabilities that are being given these drugs haven't got any mental health issues at all. And doing that work, I get to meet the most amazing, passionate people. So, psychiatrists who think it's wrong, parents and families of people with learning disabilities who are at their wits' end and aren't just despairing but are getting active and mobilising. Nurses, GPs who want to make a difference. Those people inspire me. They make me angry, and or I share that their anger rubs off on me, and their resilience and determination rubs off on me. So that influences me a lot. So the first really big change job that I had in the NHS was at Leicester Royal Infirmary, and it was called the Leicester Royal Infirmary Re-Engineering Programme. And it started in 1993, which is quite a long, 23 years ago, goodness. And I got given this job at Leicester Royal Infirmary, which was to be the programme manager for transforming outpatient services. And I came from education, and I'd learned how to do process mapping and lots of quality improvement techniques that people in the NHS didn't know how to do. So it was really easy for me. I just kind of went to the outpatient clinic and I just sat there and observed what was going on and work with people to follow the process. So I can remember I got asked to go to the board meeting of the hospital, and I got this great long strip of wallpaper. And what we did, it was a patient who was coming for a standard referral in ear, nose and throat. And from when that person was referred from their GP to when they got to a point of treatment, it took 9 months. And in that 9 months, they had 12 minutes of clinical attention. And so I went to the board meeting and I rolled out this process and I said, this is the reality of what's happening. And like everybody was like really shocked and like the scales, fell off of their eyes. So, people said, well, we need to do something about this. And it led to this amazing kind of hospital-wide re-engineering project. And again, it was about having a really good boss. I had a chief exec there called Peter Homer, and he said, Helen, go and find out what we can do. And he persuaded the chief exec of the NHS to lend us some money. And, we did this massive hospital-wide change programme. And, what's interesting, like I say, it was like 20 odd years ago. And even now, people write about it. Like last year, the Nuffield Trust wrote a new paper on cost and quality in the NHS, and they're still referring to it 20 odd years on. So, that was pretty amazing. So, I've worked in a lot of like big change programmes in the NHS and the wider health and care system. And, very often the way that we go about change is we talk about change management, and like we try and get people to do change in a top-down way. And do you know what? Often on its own it doesn't work and it doesn't spread. So a lot of the work that I've been involved in over the years is how can we take principles from social movements and apply that to healthcare improvement. So when you think, of some of the great social movement leaders, the American civil rights movement or the gay rights movement or the women's suffrage movement, the leaders of those movements had very few resources in a formal sense and no power, and yet they were able to change the world, and the way that they did it was because they identified a cause that so many people can connect with, and they were able to mobilise lots and lots of different people and build commitment. And I'd say that those principles are some of the most important principles now when it comes to the changes that we're trying to make in the NHS and quality improvement and patient safety and a great experience of care. Actually, those are things it's very hard to kind of push down on people and make people compliant with. Actually, if we can use some of those social movement ideas to build commitment, I think it's a better place to start, and I think gets us better results generally. So what's the relationship between organisational change and innovation? What I'd say is we're not going to be able to create change, and particularly effective change. I mean, anybody can do change, but change that creates good outcomes, so improvement, isn't going to happen unless we innovate. Because if we just keep doing things in the same way, then nothing ever changes. So I'd say to be able to create effective change in our organisations, change that leads to improvement and good outcomes, we have to innovate. And what we mean by innovate is to do things in different ways, potentially more creative ways and better ways. And I think too often in the NHS, what we try and do is we think, right, we're going to have a change. So we tell people that this process is going to change or this role is going to change from next week. And we don't actually build in any processes first that get people to innovate, so to think creatively about different ways and to test out and to prototype new ways of doing things. And, if we don't do that, if we don't build in those very, very important innovation stages in our change processes, we won't get very good outcomes for change. So how do I think the NHS can better manage change? Do I have one thing to say about that? And I think that is that we have to work with the collective brilliance of the people that work in the system and the people that use the system. And the more we open up the opportunities for the people that actually deliver care and the people that use care to put their ideas across and contribute and try new ways of working. Unless we do that, it ain't going to happen. Effective change in the NHS isn't a top-down process. The top-down bit is really important, but it's about the real people that do the real work and get the real care. That's where the magic is, I think, for change in the NHS. So what do I think is the most important reason for research and innovation in the NHS? I think it's to make a difference. I think that very often we go about change processes that we don't research them properly. We don't bother learning about what other people have done, so we end up reinventing the wheel. And I think there's a number of places in the NHS that do this really well. So if we're going to have a change process, what we do first of all is we do really good analysis of what's going on in our organisation. We find out what other people are doing and what they've done before. We get lots of ideas from other people. Do you know, most innovation is theft in a really good way, because what we want to do is we want to find out what other people have done, and we want to try the same thing. So actually, like researching both formal and informal research, around what's gone on before, what's worked, and innovating, I think, is critical to change. And if we research properly, and if we built in innovation processes, I think we'd be a lot further on generally in change in the NHS. So I've been asked to reflect on what do I think are the most important communication channels for researchers. Actually, I think they're the same communication channels that are most important for everybody. And that's, I think, creating an opportunity for people to come together, to learn from each other, to share passions and share ideas. So actually, I think the most important communication channels are social channels. And that may be face-to-face, it may be virtual channels. But actually, we're here today at the Northwest Research and Development event, and I think it's a marvellous opportunity for people to communicate socially, which I think is very powerful. And I think the rest of the NHS should do this as well.